Hi, my name is Alisha Subhan Mohammed from Trinidad and Tobago. This is my son Khaleem Zidane Mohammed and his father Mishak Mohammed. He has been diagnosed with acute lymphoblastic leukemia for the past year. We exhausted all treatment in our country and we came to India for a bone marrow transplant because these treatments are unavailable in our country. We met with Dr. Gaurav and he explained the procedure. There is hope in India here. The treatment here is really well. So recommend Apollo Hospital to anyone. The treatment here is excellent. The doctors, the nurses, the facilities are top class. Everything was well professionally done.
Greetings from Indraprastha Apollo Hospital, New Delhi. I'm Dr. Gaurav Kharya and I work here as a clinical lead at Center for Bone Marrow Transplant and Cellular Therapy. You've just now met Master Khaleem Zidane. So he came to us from Francophone country. So they are from India, but they migrated to one of the Francophone countries quite some time back, almost 80 to 100 years back. So he's third generation Indian, I would say. So he came to us with one of a very, I would say, not so uncommon condition in children, which is acute lymphoblastic leukemia. But his acute lymphoblastic leukemia was sort of resistant and relapsed and refractory. So after initial treatment, it came back again, and then when it came back again, it was a little bit difficult to treat. So it was refractory to the usual medications. So what we did was, so we counseled the family and we put him on a very novel strategy, which is and a newer strategy, which is a targeted therapy, which is the upcoming thing to treat such cancers. So he was put on targeted therapy, which is called as blinatumomab, to bring his disease under remission. So fortunately, with one cycle of blinatumomab, his disease went into remission. He was MRD negative, so at molecular level, the disease was eradicated, and this was the time when we took him up for transplant. Now he's the only child of the parents, so he did not have a HLA identical donor. So we considered him for HLA haploidentical transplant, which is a half match transplant, 50% HLA identical transplant using father as a donor. He tolerated it pretty well, and today he's around day 100 post-transplant. So day 100 is considered to be sort of a hallmark to say that yes, things are working, things are moving in the right direction. So he's doing extremely well. His bone marrow is working very well. His entire bone marrow is that from his father. So hopefully he will do extremely well in future, and we wish him all the very best. So relapsed refractory lymphoblastic leukemia or myeloid leukemia in pediatric patients is not so uncommon. Rather, it is the second commonest malignancy after the primary lymphoblastic leukemia. And if we treat them in a nice way, then they are very much treatable, and the outcomes have also phenomenally increased nowadays. Okay, so please do not consider any child who has relapsed due to leukemia as a gone case. He can very well be treated and cured of the disease. Thank you very much.